let me ask you a question. Are you thrilled with your health? I mean, really happy with it? That's what's supposed to happen when you go to your doctor. But if you're listening to this, you might still be suffering with neuropathy. Statistically, 90% of neuropathy sufferers are relying on medications or injections to manage their neuropathy. But we all know that those are not the ideal long-term solutions. All right, how about another question? What if we could offer you a better way to treat your neuropathy, and it could improve your condition by 60 to 100%?
Hi, I'm Dr. Robert Davis with Active Health Neuropathy Solutions, and we help people find solutions for their neuropathy. Back with Joyce, and Joyce was kind enough to come on and give us an update about her treatment in the office and the results she's seen for her peripheral neuropathy.
Well, I got neuropathy from having chemotherapy from breast cancer, and I've had that now for about a year and a half. And I was told by my doctor, my oncologist, that there was nothing I could do about it. Sessions. Now I've been coming almost every day since we've signed up, and I was able this weekend to walk the beach barefooted and in my shoes. I was able to actually feel the sand and crunch my toes. And when I go to put my slacks on, I don't almost trip because my toes will move as I slide my foot into my pant legs, where I really had a lot of trouble with that before. I'm very faithful in doing what Dr. Davis tells me to do at home. I've only missed one of drinking my nutritional stuff.
Right, very important.
That was the only, and that was just last night, and I feel better all over. It's just wonderful to feel better and not have my feet hurt.
Oh, that's fantastic. I'm very happy for you.
So am I. To try this natural without medicine and operations, because it definitely helps. I mean, it's unbelievable. I couldn't feel hot and cold.
Right.
And we were sitting out in the sun, and I just put my foot on my husband's knee, and I said, "Boy, are you warm."
Right.
I would never have felt that before.
Right.
And just little things like that. I mean, you can tell they're coming back. I mean, you're silly not to try to make yourself better.
Neuropathy is a disorder of the peripheral nerves. Those are the nerves that go down into your arms, hands, legs, and feet. The peripheral nerves are anything outside of the central nervous system, which is just the brain and spinal cord. So, the peripheral nerves, like the ones that go down to your hands and feet, are the ones that are affected in neuropathy.
If you're like many of the patients that come into our office seeking help, you may have been diagnosed with diabetes, maybe you're a cancer survivor and you went through chemotherapy, or at some time in your life you could have been exposed to a dangerous chemical such as Agent Orange. It could be that you were in an accident and you damaged the low back and you damaged the nerves in your low back, and now you have symptoms of peripheral neuropathy. You have burning feet, pain in your feet, pain in the lower leg. You might have symptoms of not being able to feel the ground, so you have trouble walking. You have trouble driving because you can't feel the pedals. Whatever these symptoms are, it's not okay, and I feel for you. Listen, if you're experiencing these symptoms of pain and burning in your feet right now, what is happening is those nerves are dying. Your body has lost the ability to get blood flow, which carries the nutrition and oxygen to the nerve, and that nerve is dying. That becomes very painful before the nerve completely dies and you don't feel anything. And guess what you're facing then? Then you're gonna have to get amputations. They'll start with the toes, they're gonna go to part of the foot, the ankle, and then they start amputating the lower leg. I'm not here to scare you, I'm here to wake you up and understand this is a serious problem.
Peripheral neuropathy is one of the most common chronic conditions in the United States today. About 8% of the United States population suffers from peripheral neuropathy, which is about 24 million people and growing. Peripheral neuropathy can occur at any age, but it's most common among older adults. We've seen patients who have neuropathy who are from age 30 to 101. The most common cause of peripheral neuropathy is diabetes, and also idiopathic, which means the cause is unknown. But we can treat neuropathy that comes from many different causes. We don't only treat patients who have neuropathy from diabetes.
And I am here with Diane, and she was kind enough to come on and kind of tell us about her experience in the office.
I have tried everything else. So I thought, well, I'm going to give this a shot. And the first time I came in here, as you know, I couldn't even walk up the stairs.
Right.
And when I left here, after all the work that you did on my knees, I was able to walk, and that was a blessing for me because
Right.
I want to walk.
Yeah.
Yes,
Yeah.
I can feel I can feel my toes again,
Right.
and I'm not happy. That's wonderful. I mean, I can sleep at night and I don't feel that tingling in my toes.
Right.
So, yeah, I'm very happy with.
Absolutely. When I first came in, I want to thank the great staff Dr. Davis had. Unbelievable. Very comfortable feel in here, no pressure at all. They make you feel really good. Direction they gave me was good. Just as long as you follow it, you'll get results. I was very skeptical. I was just figuring this is a nut I've been doing for years, trying to find a solution to my neuropathy. Boy, it was horrible. Needles, pins, burning sensation, the worst ever. I just gave up and just kept trying. This was probably my last resort here. And in a couple of weeks, all of a sudden, then the change started. Boy, the burning stopped and needles and pins stopped. Now just a little numbness I have, but the direction it's going, never have I ever been feeling so good. Energy levels are up. You just get a great feel from when you start to heal with anything you have, especially after having 7 years of this I've had. And it's just tremendous what Dr. Davis has done for me.
All the information we're about to present comes from the Centers for Disease Control and the World Health Organization, and you have a right to know about this as a patient. Bottom line, if we do the same things over and over again, we're going to keep getting the same results. We have a saying here in our clinic: if nothing changes, then nothing changes. This applies to both patients and doctors. The conventional approach to treating peripheral neuropathy goes like this: prescribe medication. Wait until the condition gets worse. Then maybe increase the dosage. Wait until it gets worse again. Then maybe add in some more medication. Wait until it gets worse. And then pretty soon you have to add in the really heavy-duty pain medications. This goes on until the patient is completely debilitated. And as a last resort, you have amputation.
Hi, it's Dr. Davis with Active Health Knee and Shoulder, and I am back with Phil. And Phil was kind enough to come back on and kind of give us an update with his neuropathy condition that he's been treated for in this office, and he's also doing a lot of therapies at home. So he's noticing some good things, some changes, and I wanted him to kind of explain the changes that he's noticed. So Phil, if you could just kind of explain what we were talking about earlier.
It feels like it's actually little pulsations type situations,
Okay.
and that's why I meant by that would maybe the surge of blood
Right.
going there, because it pulses every couple of seconds like into there,
Yep.
and until the treatment is over,
Mhm.
and then of course things start to go back a little more to normal over the mat. But as I'm doing the treatment, I can actually
Right.
feel that sensation now.
Would you say, is it painful? Is it an uncomfortable sensation, or just kind of an
No.
odd sensation?
No, it's just a little bit different. It's just like somebody trying to give you a little poke, but it's a very light poke.
Right. So when people start to get neuropathy, the numbness and tingling, the burning pain, the coming and going of all these sensations is actually the nerve dying. It's the pangs of a nerve that's trying to survive in an environment that doesn't have proper oxygen and it doesn't have proper blood flow and nutrition. So it can't survive. And it feels that, and you actually feel the pains of that nerve dying. So when your body starts to heal and you do the therapies, because Phil's been great, he's been doing all the therapies, he does a lot of things at home, and what we're doing is increasing nitric oxide blood flow, we're retraining the nerves and the energy, so that's the sensations he was getting before, and now he's starting to get the sensations where the nerves are coming back alive. So he's actually nourishing them with oxygen and nutrition. And so even though it's a weird feeling that he's getting, it's a good feeling because those nerves are coming back to life again. So
We have different types of nerve fibers for different things. Some of them sense pressure, some of them sense the position of your feet relative to the ground, some of them sense vibration, some are for cold, some are for hot, some are for light touch, and some are for heavy touch. Neuropathy usually starts in one foot most of the time. Sometimes it starts in both feet. You might have symptoms for 2 days of the week, and then it will progress up to 4 or 5 days out of the week. It might still only be in one foot, and then it will go into the other foot, and then it starts going up your leg. Neuropathy will progress slowly for about 2 to 5 years, but then at a certain point, it will get dramatically worse, and at the end of that drop-off point, it is no longer treatable. We try to reach people and help them before this drop-off point so that their neuropathy can be treated successfully.
The infrared mineral lamp, it has a mineral plate on the outside. So the lamp is in the spectrum of infrared. It goes through a mineral lamp and then it penetrates the tissue. So why does this work? Why would anybody attempt to do something like this? This was discovered, from my understanding, in China many years ago. In rural China, there was a ceramic factory. And the story goes that this ceramic factory had a gigantic kiln, where they put the pots and everything inside. And you had a bunch of workers that would work outside of this kiln a day in and day out. And from what I got from the story is that the working conditions were not good. They were actually very poor working conditions. But when the state came out to investigate this village, they discovered that the people in the village were extremely healthy at all ages, and they had been working for this ceramic factory for most of their lives. And they discovered that what was happening was that the infrared, the heat coming off the kiln, going through the clay that had caked up on the outside of this kiln, was actually penetrating their bodies while they were working, throughout the day. And the minerals actually made them healthier. It increased blood flow, it decreased inflammation in their body. So that's the story of why this works. And I know firsthand that it helps to decrease inflammation. It helps to get blood flow to an area of the body, whether it's the knee, shoulder, back, your peripheral neuropathy in the feet. It definitely helps to decrease pain and decrease inflammation. So that's the infrared mineral lamp, and that's why we use it in the office.
Imagine for a minute that you have a plant, and you see that your plant is wilting. What might you do to get the plant healthy again? Well, maybe you might think it needs something, such as water, maybe more sunshine, or maybe even some nutrients like fertilizer. Those are logical things to think about when we see a wilting plant. If adding things doesn't work, well, maybe the plant has bugs on it, or maybe it's planted in some bad or toxic soil that might be causing it to be unhealthy. The same principles apply to your body and your health, especially when it comes to neuropathy. We have to give your body everything it needs in order to work properly. We are a living organism just like a plant, and we have certain requirements that we need.
Now the therapy that I'm on right now, this is no magnetic bracelet, okay, or refrigerator magnet. This is a pulse electromagnetic field therapy. And what this machine is doing, it's sending a pulse magnetic field into the tissue around my knee. So we use this to help people with chronic degenerative knee pain. And the reason why we use this is because this is an FDA modality that has been proven to heal bone in 1/3 of the time than it would take normally. So why is that important? Well, many years ago in Western Europe, a doctor came up with the idea, the theory. He knew there was a piezoelectrical effect happening when these racehorses would break their legs and they would form a non-union bone fracture. Their legs were so narrow that when they would go weight bearing, the fracture would fall apart. Well, he knew the physiology, that there was electricity happening around the broken bone. It's called piezoelectrical effect. So a lot of electrical energy is happening when you break a bone. So he thought in his mind, well, what if we could just increase this piezoelectrical effect? That's exactly what he did. He started messing around with different frequencies of pulse electromagnetic field, and he came up with a frequency that would actually help the bone to heal. And the FDA has even looked at all that research and deemed it effective. It heals bone in a third of the time than it would normally heal on its own. So why is that important to somebody with chronic knee pain if they haven't broken their knee? Because cartilage cells that make up the cartilage tissue, ligament cells, muscle cells, they all have a similar structure, right? They have a nucleus, they have a mitochondria, which is the battery, and this is simply charging the battery of the cells. When you charge up a cell, it becomes more efficient, its metabolism increases. You have more nutrition entering the cell and you have more waste leaving the cell. That makes for healthy tissue. So all this is doing is promoting healthy tissue. It's helping to decrease inflammation, it's helping nutrition to enter the cells and helping to eliminate waste. So that's why we use the pulse electromagnetic field. Now,
Did you know that one of the most commonly prescribed drugs for peripheral neuropathy is not even designed to treat peripheral neuropathy? Generally speaking, about 20% of drugs are prescribed off-label. Off-label means that the drug is designed or approved for one condition, but it's used for other conditions. The use of gabapentin, or Neurontin, has become so widespread that as many as 90% of prescriptions are for off-label uses, such as the treatment of peripheral neuropathy. Are you tired of taking medications? The truth is, most of us don't like taking a lot of medications every day, especially in the long term. They always come with side effects, and it's just not the ideal long-term solution to treat the underlying causes of your condition.
and I am here with Manny, and Manny was kind enough to come on and tell us about his experience. He came in for treatment of peripheral neuropathy.
I mean, great staff, so they're very welcoming when you walk in the door, and you've explained pretty much everything that was going to happen, and it did. Except I think it happened a lot quicker than you thought.
Yeah, right when you did the therapies, it
Right.
started subsiding.
I was taking this pills, whatever the name of that is, and it was making me sleepy. And so after the first treatment,
Yes.
I took half. I
Right.
took half a pill, and then I came in and I did another treatment, and then I tried it without it. And I've noticed a huge difference. Huge. I mean, it's probably 95% gone now. If you have neuropathy, you don't have to suffer from it or suffer from the medication they give you.
Right.
That there are answers, and I think for me anyway, the big answer was right here. With Active Health.
And we are here to go over our home testing for our neuropathy solutions program. So I'm going to go step by step and show you exactly how you're going to do the test at home. And Becky, my lovely assistant, was nice enough to come on and let me use her as a patient here today. So first of all, in your home care kit that you'll get in the mail, you're going to get 2 sheets. One will be for the feet, and the other one is going to be for the hands. Okay, they look fairly identical, except one will say feet and the other will say hands. All right, make sure that you actually put the hands on top. So we'll put the hands on top here, and you're going to put your name at the top and put the date that you're doing the test. Now in your test kit, you're going to have a number of testing tools. One of them will be a pinwheel. So you're going to get a plastic pinwheel like this. You're going to get a little piece of leader line. Okay, that will be used as your microfilament. Can you see? All right. You're going to have to go in the kitchen, get yourself a butter knife. We will send you a Meditip like this. You'll have one of these. You're going to also need a hair dryer, and either you get a sandwich bag and put some ice in it, or put a water bottle in the freezer the night before you do the test. Okay, you're ready to go. So the first thing that we're going to do, if you look at the top here, it says cold sensation. Okay, we're going to start with cold sensation, then we'll do pinwheel, microfilament, the cool sensation with the butter knife, micro tip for the poke, and then we're going to do hot with the hair dryer. So let's start with cold. Okay. Number one, you're going to set your reference of a 10. And we're going to use the elbow right up in here. So can you just turn your arms up like this? So you're going to do it just like this. So you need somebody to help you with this. Okay, this is what a 10 feels like as far as cold. So if this is a 10, what is that?
A 7.
A 7. Okay, if this is a 10, what is your foot?
I don't feel anything.
Okay, so that would be a 0. So you want to stop. We just did the left side here. She had a 7 and a 0. So press pause and you're going to write that down because I want you to do the exact same thing that I'm doing. So you're going to write it down. You would write down on the left hand a 7 and the left foot a 0. All right. All right. Now we move on. We're going to move on to the pinwheel. Okay. We're going to establish a 10. This is a 10. What is this?
A 7.
7. This is a 10. What is this?
A 3.
Okay. So we have a 7 and a 3. We're going to write it down. 7 for the left hand and 3 for the left foot. So we're going to continue with the microfilament, and this is a little bit different. We're going to touch in 5 different areas. So I'm just going to mark the areas where we're going to touch. Okay, you don't need to do this, just get an idea of where we're doing this. And here. Okay, and then also on the foot, I'm going to do the same thing. Here, here, in the center, on the outside, and here. So if you can just zoom in on that. So we're going to go ahead and do the test. Can you see that outside one there? Mm-hmm. Okay. So this is how we do this part. This is the microfilament test. I'm going to touch her hand, the palm of her hand, in 5 different places. Your eyes are going to be closed. You only say yes when you feel it, okay?
Yes. Yes. Yes.
Okay, so she missed 2. There's a total of 5. She missed 2. For each place she missed, it equals 2. So it's 2 times 2 is 4. The total would be 10. 10 minus 4 is 6. She got a 6 for her palm. So you're going to write down a 6 for the left hand. You'll just circle a 6 on here under microfilament. And then for the foot, we're going to do a very similar test here. Okay? Close your eyes. Just tell me when you feel it. Touch very lightly.
Yes. Yes. Yes.
So again, she missed 2 on her foot as well. Each place she misses equals 2. It's a total of 10. So 2 times 2 is 4. 10 minus 4 is 6. She got a 6 for her hand. She got a 6 for her foot. And we're gonna do this for both. So you do both sides. We're just gonna go down the left side. You do the exact same thing on the right. Okay, so the next test is cool sensation. You're going to just use a butter knife. Okay, just use the back of the butter knife. We're going to set a reference for a 10. So this is what a 10 feels like as far as cool sensation. If this is a 10, what is this?
A 10.
A 10, okay. If this is a 10, what is your foot?
About a 4.
4. Okay, so you're comparing it to her elbow here. She got a 10 and a 4. You're going to pick up your clipboard here. And for the cool sensation, She got a 10 for her left hand, and she got a 4 for her left foot. Now we're going to move on and to the Meditip. So the Meditip is basically just a poke, but it by using this, it measures the depth so you don't go too far. So there's a little pin at the plastic pin there. Okay, and what you're going to start with her elbow. So this is a 10. If this is a 10, what is this?
A 10.
Okay, 10 on her hand, her left hand. If this is a 10, what is that?
A 2.
A 2. Okay, so she got a 2 there. So you pick up your sheet. Okay, we got a 10 for her left hand, and we got a 2 on her left foot. And now we're going to the final test, which is hot. And we're going to use a hair dryer. Okay, and you just turn it to high. Okay, let it get hot. You're going to just go briefly over the area. That's a 10. What is this?
10.
Okay, move it away. This is a 10. What is your foot?
I don't feel anything.
0.
It's a 0.
Okay, so she got a 10 on her palm. She got a 0 on her foot. You pick up your sheet. You're going to write down exactly what you just tested. You got a 10 for the left hand as far as hot, and she got a 0 here. Okay, the next thing that you're going to do, you're going to add all these up, okay, and put the total at the bottom. So you're going to need to repeat everything that I did on the right side of the body as well, and add everything up and get it to it as soon as possible.
Well, actually, when I found your office on Facebook, I was experiencing lots of neuropathy, pain, the itching, the burning in my feet and hands. As a result of coming here for, I believe this is my 8th week, I'm proud to say that I have really felt quite a tremendous difference in the attacks that I was having, the burning sensations. When I experience any neuropathy, it's not as forceful as I usually experience before you coming to your office. So I'm just proud to say that it's been a blessing, and I'm truly, I thank you and your office for being so nice and providing this service for us, those of us who are suffering with that.
You are more than welcome. I'm so happy that you're getting the results that you came in for. Thank
Yes.
you for sharing that with everybody.
You're welcome.
Thanks, Eddie.